Now, most of the time, your hair will return after chemo. It may not be the same texture. It takes 2 years for the texture usually to come back. Most likely won't be the same color. Sometimes it's the color you were born with. A lot of times, if you're over a 35 or 40, it will come in a little gray or white. Sorry, ladies. It's suggested not to use any peroxide until about 8 months after chemo is done and finished, and your hair is nice and strong, but you can use vegetable dye in the interim. So let's talk cold cap, shall we? Here's a photo. You can see she has it wrapped around her head. Now, the cold cap treatment is often referred to as scalp cooling systems. And the way they're used is during chemotherapy, it helps reduce the hair loss. How? They work by cooling the scalp, which narrows the blood vessels to then limit how much chemotherapy gets to the follicle. That's what it is in a nutshell, okay? And the concept actually began in the 70s out of Europe, when they basically used ice pack and they would like constantly change gel caps on the head, and it was difficult and it wasn't widely accepted and it had limited clinical data, so the effectiveness wasn't that great over time and it didn't go anywhere. But then in the 1990s to 2000, there was some improvement with companies like Paxman out of the UK and Dignitana out of Sweden. They maintained more consistent temperatures, their effectiveness was better. And then I think the turning point was really in the United States in 2015, when DigniCap scalp cooling system was the first one to actually receive FDA clearance for the first product to actually reduce hair loss during chemo. In 2017, then Pacman scalp cooling system came on the market, and they were able to expand the access and a broader adoption to it. And then, of course, then the Penguin Cap came in, which is more of a manual cold cap program. And they're widely offered. These are widely offered. Now, they claim you're supposed to be able to keep 80 to 90% of your hair with the cold cap. I'm not so sure. I've only seen a handful of clients personally. I've heard about others that have kept most of their hair, like 95% of their hair. My personal clients that I have personally been involved with, I would say 75% of them have lost about 60% of their hair. But then there are some that have kept maybe 75 to 80%. I think it's all individual. I say give it a shot, right? It certainly has the data behind it. If it works for you, awesome. If it doesn't, there's always a wig. You may need to get a wig in the interim anyway. If you're left with about 60%, you're gonna need a wig. But I say give it a shot.